The British public won't hear how the government plans to ease its 7-week lockdown for another week. But there are reports it's likely to involve officers having to maintain 2 metres social distance between staff, no shared desks, office canteens being closed, and staggered shifts to reduce the pressure on public transport. Meanwhile, the chief executive of Heathrow Airport says social distancing at airports is impossible. John Holland-Kaye says, forget social distancing. It won't work in aviation or any other form of public transport. And the problem is not the plane, it is the lack of space in the airport. Just one jumbo jet would require a queue a kilometre long. And the government has announced it's trialling a new COVID-19 tracing app on the Isle of Wight.
If you become unwell with COVID symptoms, you inform the NHS via the app. Other app users who you've had significant contact with in the last few days will then be sent an alert by the NHS along with advice about what to do.
The National Health Service has announced that from next week, its 4,000-bed field hospital in London will be placed on standby. It's only treated a total of 54 patients. It was set up in a convention centre in 10 days. But so far, hospitals have been able to handle the number of COVID patients. Their main problem hasn't been a shortage of intensive care beds, but a shortage of personal protective equipment. All this while Boris Johnson says many people will be looking at the UK's, quote, apparent success against COVID-19. It's hard to see how more than 28,000 deaths could be defined as any success. Nicole Johnston, CGTN, London.